An anesthesiologist is a physician who assists the patient through their surgery. And we evaluate them before they go to surgery. And then we put monitors on and we give them medicine so that they go to sleep. And we give them medicine to help with pain control. And then once their surgery is done, we wake them up, take them to recovery area, and we make sure that their pain is well controlled and that they feel like they're back to their baseline so they could either go home or they get admitted to the hospital depending on the type of surgery they've had. What I love most about being a pediatric anesthesiologist is taking care of all children, and it gives me great happiness to help them through the surgical procedure and make sure that they're doing well, that they're safe, and that they're getting pain medicine to reduce the amount of pain they may have and get them through the whole surgical procedure. So most of us are there somewhere between 6:30 and 7. And then you evaluate your patient, and you do your surgeries. Every day is a little different because you may be working with one type of surgeon one day and a different surgical specialty another day. So your room assignments change every day, which is what I like about it. And the other thing is that the type of procedures you're doing changes every day. So that's also why it's so interesting. And we work until the operating room is done for the most part. So most operating rooms start closing down around between 3 and 5 p.m. But then you have to be on call for emergency surgeries. And so there are days that I have to be on call. And so I could go home, but if I get called in, then I have to come in and help with that surgical procedure. Anesthesia is definitely one of the fields that lacks a diverse workforce. The American Society of Anesthesiology recognizes that, and they're in the process of trying to figure out how we can help improve that. But I think, to me, one of the things that would be helpful is to maybe have an anesthesia elective not be an elective and be required. Because I think a lot of people miss out because they don't rotate through anesthesia at all. Even if it was just a week rotation, I think it would expose people to see what anesthesia is and maybe increase the diversity in the workforce. I also think that people maybe get intimidated because it's the operating room. That's not an environment that is necessarily easy either. There's a lot of people. It's a little intimidating, I think. So I think that's another reason why maybe people turn away from it right away.